controlled substances are heavily regulated. This is due to their addictive properties. Now, Dr. Timothy Quinn joins us now to talk about the process and why it is so strict. All right, Dr. Quinn, thank you for joining us as always. Talk to us about your personal experience.
I've had so many experiences over the last 23 years. I've had patients state that they're going to threaten my life or physically harm me. And I was warned about this when I first returned to Mississippi from Los Angeles 23 years ago by some of my mentors. They said, "You're a young doctor." I was young back then. They said, "People are going to try to abuse your clinic." We call them drug seekers. And they'll come to your clinic and they'll request so much controlled prescription medication like Xanax or Percocet or hydrocodone. They said, do not give in to these people's threats because you can lose your license.
Absolutely, we don't want that. Don't give in. Dr. Quinn, why is there such a strict evaluation?
Because these medicines can be harmful if they're prescribed inappropriately, meaning that people can become addicted to them. They can take too many of them. And then there are some cases where people will go out in the streets and sell them for cash money. And as a physician, you want to try to limit that as much as possible, putting patient safety first.
Okay, so what steps do you have to follow?
We have to check something called the PMP, which is an online tool that we medical providers use called Physician Monitoring Program. And what it does is it shows us how often they've gotten the medicine, where they got it, when they last got it. For instance, I had a patient maybe one day last week that came in and wanted a refill on some controlled substances and told me that he was seeing a psychiatrist in Minnesota in the past and he's new to the area. So we pulled the PMP, the listing, and it showed that he had picked up prescriptions every single day for the last 10 days from different physicians' offices with different prescriptions with different quantities.
All right. So if you need controlled substances, you got to go to your doctor.
You have to go see your doctor. That is correct. And you have to go in person, and then they'll evaluate you and determine if you are somebody that is eligible and would benefit. But in a lot of cases, like me personally, because I'm a primary care physician, if it's for psychiatric medication, I'll send them to a psychiatrist for safety. Or if it's pain medicine, I'll send them to a pain clinic or a specialist, orthopedics, rheumatology, pain management. In a lot of cases, they have to do urine drug screens to make sure they're not on any illicit medications or street medications like cocaine or something. They're mixing it, and then they're monitored properly for the highest level of safety.
All right. Thank you, Dr. Quinn. This is all the time we have.